Hello dear students, I hope you all are doing good. We will discuss about the questions that are basically concerned with forensic toxicology. So the very first question is, alkalinization of urine is indicated in poisoning by. If you know the answer, then do pause the video and comment down your answers below. So for the patient who have serious salicylate poisoning and who do not meet the criteria of hemodialysis, urine alkalinization is considered to be their very first line treatment. So the option A is gonna be the correct answer. Then the second question. Maximum diaphoretic action can be seen with. Maximum diaphoretic action can be seen with. And here are your respective option. What is diaphoresis? This is what you have to understand first. Diaphoresis refers to the condition of excessive sweating. So here are the options and the answer is gonna be option C, pilocarpine. 10th question is somewhat based on the memorizing. Narcotic drugs and psychotropic substances act repels. Poisons Act, no. Drug and Cosmetic Drug Control, no. The answer will be the Dangerous Drugs Act that was passed back then in 1930s. This is very interesting question. Wall scrapings can be used as a first aid remedy in which of the following? These are the images of wall scraping, and it is also used as a remedy. The answer would be oxalic acid. In the case of poisoning of oxalic acid, you must remember that oxalic acid is a weak acid and it is also found in trace amount in tomato. Fatal dose of opium is about. Do comment and let me know answer of this question. This is your homework question. Then the specific antidote referred in opium poisoning. This is a very common question that is often asked in UGC NET examination as well. For opium poisoning, the only and the only most well known antidote used is naloxone. Moving on to the next question. In case of dhatura poisoning, stomach wash normally should be done with. Stomach wash involves cleaning out of the content of stomach. It is also known as stomach pumping or gastric irrigation. It is commonly done on a person who has ingested a poison or who has taken an overdose of some kind of drug. So here in the case of dhatura poisoning, the potassium permanganate, the KMNO4, option A would be the correct answer. Then antidote preferred in the case of dhatura poisoning. These two questions are somewhat correlated. In case of dhatura poisoning, mostly Physostigmine, option A would be correct answer, is mostly used as an antidote. Like we have seen in the previous question, in case of opium poisoning, naloxone was used as an antidote. Red colored tears may be seen in acute poisoning of. Red colored tears is a rare condition where tears contain some amount of blood, and that could be due to medical condition, that could also be due to some underlying trauma, some medicine, anything could be the reason for this red colored tear, and answer would be option C, that is organophosphorus. Physical dependency is normally not produced in the case of mostly the drugs that people consume for medication purpose or whatsoever leads to physical dependency, often making that person an addict. But in the case of LSD, lysergic acid diamine, there is no such cases, no dependency would be observed. Then, black colored teeth may be seen in chronic uses of teeth like this. Blackening of teeth is the most common indication that person may be addict to usage of cocaine. And option B is gonna be your correct answer. Then, usual fatal period in case of potassium cyanide poisoning is. We can solve this question by the use of elimination method. Immediately is not the choice that we would make. Then 1 to 2 minutes or 2 to 10, but no, these two are also being eliminated. Answer would be about 30 minutes. Then affinity of carbon monoxide in comparison with oxygen for hemoglobin is. The carbon monoxide leads to the formation of carboxyhemoglobin, and the affinity of this fatal component CO, carbon monoxide. Death via carbon monoxide occurs when the coal or something of that sort, carbon containing compound, is burnt in closed room. Due to asphyxia, mostly death of the patient or person occurs. Answer will be 200 times. So the affinity of carbon monoxide to bind with hemoglobin is 200 times more greater than that of the oxygen itself. Hypostasis is cherry red in color. Okay. In case of which of the following poisoning? Here are some of the examples, and if you know to eliminate them by knowing their true colors, then you can figure out the answer easily. So the answer will be option number A, that is carbon monoxide poisoning. Carbon monoxide, about which we discussed in the previous question. And what about rest of this component? In case of phosphorus poisoning, chocolate brown color of hypostasis is observed. In case of hydrogen sulfide, a greenish blue color of hypostasis, whereas alanine, it shows deep blue color of hypostasis. So I hope you have enjoyed this session, you have liked the question, and you might be able to solve most of these questions. If not, then do read the topics again. And if you want more questions on this topic, then do let me know in the comments below. Thank you so much.